Tonight, a crisis for moms and babies in Arkansas. Across rural parts of the state, hospitals are shutting down their labor and delivery units, and that forces pregnant women to commute up to 2 hours to give birth, or even just to see a doctor. And if something goes wrong with that pregnancy, families are saying help is too far away. Tonight, THV11's Tanya Motorzitsky hears from advocates and why they are calling it a crisis.
In much of rural Arkansas, giving birth now comes with warnings. No nearby hospital, long drives, and for women with high-risk pregnancies, those delays can turn deadly. Health advocates say this is not a fluke. It's a result of labor and delivery wards continuing to close. The latest one happening last month.
Google became my friend. Google became my doctor.
Carisha Freeman's experience in rural Arkansas is not unique.
I found out I was a diabetic while I was pregnant. So it was trying to get to where I needed to go to get the care I needed. I didn't have the care of, somebody helping me with my being a diabetic in Arkansas. I had to go deliver my baby in Memphis.
With labor and delivery units closing, it's forcing pregnant women to travel long distances, turning routine pregnancies into risky journeys, with transportation being the biggest roadblock.
The last couple of weeks I had car trouble and I missed a lot of my appointments. I missed like 4 in those last moments because I didn't have a transportation. I went from taking a half a pill every day, being a diabetic, to being on insulin 4 times a day.
Freeman's story reflects a growing problem across rural Arkansas. Data from the World Population Review shows Arkansas consistently ranks among the highest in the nation for maternal health risks and infant mortality. And hospitals closing the doors on their OB/GYN departments is not helping.
What we have here in Arkansas is a maternal health care crisis.
In January, Ouachita County Medical Center shut down its labor and delivery unit, the latest in a growing list. Now there are only 33 delivery hospitals in Arkansas. OCMC CEO Glenda Harper says closing was a tough decision, but the hospital faces millions in debt.
We've worked really hard over the past 6 months that I've been here to try to maintain that unit, and with the reimbursement cuts and losing nurses and the number of physicians, it just has turned out to be an impossibility to maintain.
A decision that Pafford Medical Services Chief Operating Officer Clay Hobbs says is a growing crisis.
No one called the ambulance service in any community when the OB department closed at a hospital, but the responsibility fell on the ambulance provider and the paramedics that are responding to those 911 calls.
And is stretching ambulance services thin.
In a lot of rural communities, there may be one ambulance serving the entire community. And if that ambulance has to travel 90 miles to the nearest facility that has an OB department, that can create a healthcare emergency in that local county. And there may not be another ambulance available then for 3-4 hours.
He says there's no longer any labor and delivery units in southwest Arkansas.
The ambulance provider becomes the OB/GYN expert in that community, and then is charged with delivering those babies.
And adds it's terrifying to think of complications that can happen to mom and baby.
We don't have an operating room for a C-section. We don't have additional resources to help resuscitation. It's an EMT and a paramedic in an 8x8 box ambulance on the side of the road in a rural community in Arkansas delivering a baby.
While Ouachita's hospital's emergency room will help with deliveries if needed, and paramedics are trained to help in most situations, Hobbs says they still need more resources.
We have to build up the ambulance provider. There has to be training, there has to be equipment, there has to be funding to make sure that we can sustain those operations in communities that don't have OB services available.
In the meantime, while the state looks at solutions, there are programs and people who will help fill the gap, like Nicole Fletcher with the Doula Alliance of Arkansas and co-founder of Ujima Maternity Network, who says a recent state law has more doulas being trained over the next year.
There's a significant number of doulas that are already working, but now we're adding to that field, 40, nearly 50 more doulas to work and plow this ground.
Doulas, while they don't give medical support, can help inform and advocate for pregnant women and babies, while midwives help with the medical support. Fletcher says these services complement each other. Education, Fletcher says, is key to navigating this terrain.
We need to stop looking for the government or some system to save us. That is the biggest issue that we have, and we're going to keep running into when we're looking for somebody to save us. Like, you have the responsibility to understand what's going on, to pay attention, to clue in, to do the work to save yourself.
Sylvia Halliburton, executive director of Arkansas Birthing Project, says their mission is to improve maternal and infant care through education, support to help with appointments, rides to those appointments, and other needed resources.
They will provide you with someone to support you, show you how to build your team to provide the necessary support, whether it's mental or just emotional support. We all need somebody.
Services, Freeman says, supported her during pregnancy.
After I talked to Miss Sylvia and realized, like, okay, this is some stuff I never even thought that could happen or would happen. So to create a birth plan and her help me with that was amazing too.
Halliburton says there is a way to help fill the maternal health gap.
And I would love to see a birthing center in our area. Not just a birthing center with women who understand and have compassion.
Currently, Hobbs says he's making sure all hands are on deck to address this crisis.
We are working now to put together a consortium of hospitals in Southwest Arkansas that will bring 6 hospitals together and 2 ambulance providers in those counties to help work together to have shared resources and operate much like a consortium to where they can help each other out. And we're working together with those hospitals and other healthcare providers to sustain that.
If there's not a solution, Hobbs and advocates fear we'll see more and more babies delivered on the side of highways. Tanya Motorzitsky, THV 11 News.
Tanya, thank you. And one more thing from the ambulance director there, Hobbs. He says Arkansas has some of the lowest Medicare reimbursement rates in the country. That was one of the key points that Governor Sarah Huckabee Sanders wanted addressed by a maternal health task force that she formed 2 years ago tomorrow.